So in my talk this afternoon, I will give an update on the CLL2-BAAG trial, which is a phase II trial where we evaluate the triple combination of Obinutuzumab, Acalabrutinib and Venetoclax, and we have an optional debulking in the beginning with Bendamustine. That's why we have the B in the beginning of the name. In this trial, we treated 45 patients with relapsed CLL. These were rather young and fit patients, but it was a cohort that was enriched for high-risk abnormalities. Three-quarters of them had an unmutated IGVH status, and 1/3 had TP53 abnormalities, and 1/3 had a complex karyotype. So it's rather a high-risk cohort, and all of them were previously treated. Almost half of them had already received a targeted agent, mainly BTK inhibitors or Venetoclax, in some cases also both of them. In the trial, only 18 of the 45 patients received the Bendamustine debulking, and then they received the induction treatment with a triple combination, which started with the Obinutuzumab for one cycle as a single agent. Then the Acalabrutinib was added, and in the third cycle, the Venetoclax ramp-up started. So after 6 cycles of the combination treatment, we had the final staging, which was the primary endpoint of the trial. And at that time point, 13% of the patients had achieved a complete remission, and 76% had undetectable MRD. Now afterwards, patients continued the triplet combination in a maintenance phase until they achieved complete remission and undetectable MRD. And with this continued maintenance treatment, the rate of complete remissions significantly increased to 44%, and the best undetectable MRD rate increased to 93%. So 25 of the 45 patients were able to stop maintenance treatment early due to this deep remissions. And after the cessation of treatment, these deep remissions continued to remain. And the progression-free survival so far with this updated analysis is 90% at 30 months. So it's quite a nice result for this high-risk cohort. Also, when looking at the patients who had already received the prior targeted agents, they did simultaneously well. The undetectable MRD rate and PFS in these patients did not differ from the entire cohort. With regards to safety, we did not see any new signals or cumulative toxicity with the continued maintenance treatment.